Hi, my name's William Rockwell, and
My name is William Meyer.
this is our case study on our Aunt Christy and her diagnosis with MS. So the pre-screening, we looked at her levels of physical activity. She bowls twice a week, goes on a 30-minute walk once a day, and unfortunately, she was diagnosed with early onset MS. Thankfully, we were able to catch it early, so now we're just trying to slow the onset of it and slow her symptoms. Her desired intensity is about 30 to 45 minutes per day of exercise. We want to improve her balance, improve her grip, and help just slow down the symptoms of MS.
And some precautions and considerations that we're going to have to note are with her diagnosis of MS, she's going to have autonomic disruption. So she's going to be able to overheat very quickly. So we're going to make sure that she's working out inside. She's going to want to do it as a home workout program. So that kind of restricts our exercises a little bit, but she's also willing to buy equipment. So that's a plus. She has balance errors based off of her best test. So we have to improve her balance. There's side effects. She just got prescribed teriflunomide, and the side effects of that are headache, nausea, and this could impact some of the other drugs that she's taking. So we're gonna have to note some notes there. She's noticed a loss in grip strength, so we have to make sure that that's pretty substantial since she noticed it. So she's going to want to improve her grip strength. And this can grip strength relates to like longevity of life pretty much. So we want to make sure that she can improve her grip strength and have a better quality of life from there. And since she's 66 years old, she is at a high blood pressure risk. So we want to make sure that that stays in check as well.
All right, now on to our first study. So with this study, there were two groups. One was completing home exercises, the other did not. Participants were 60 years and older, so this does apply to our Aunt Christie. The exercises that were performed were static balance exercises such as feet together, single leg stance, and tandem stance. It was over a 12-week period with two sets of 30 seconds three times a day. So this exercise selection as well as intensity is ideal for our Aunt Christie, just based off her intensity that she wants to achieve. And the exercises help reduce fall risk, teach core stability, and helped the participants aid in visual balance systems. Now, the limitations are the sample size was pretty small with this study, but our Aunt Christie is untrained. So, like these participants in this study, they were also untrained. So we can help use this study to help accurately prescribe exercise and intensity to our Aunt Christie.
This next study had 30 individuals with MS. They split them up into two groups, a resistance training group and a control group. They did these exercises over a 10-week period. They did the exercises of leg press, leg extension, hip extension, and seated calf raises 3 times a week with their weight varying based off of individual one rep maxes. So it was 60 to 75% of their one rep max. There was also a baseline balance test performed on a platform so we could notice the differences from the start of the program to the end of the program. So the results of that were the resistance training group consistently improved and the control group actually worsened. So, and this can apply to our Aunt Krista because these exercises can help strengthen her gluteus medius, which is a big factor in her maintaining balance.
All right, now to our third study. So this study was assessing and prescribing fine motor skills and fine motor tasks to participants. These fine motor tasks includes turning magazine pages, putting a pen in and out of a glass, opening a cardboard box, and screwing and unscrewing a bottle top. Now the intensity was pretty high with these exercises. It was twice per hour for 5 hours a day, and this was over a 12-day period, so 120 total sets. Now these exercises were not fatigue inducing, just because they were fine motor skills. Now, this is super important because our aunt, we don't want to fatigue her too much throughout her exercise, so we can use this study to prescribe fine motor tasks that will help improve her muscle strength and dexterity from her baseline measurements.
So, and just to summarize all of our studies, The research articles, they demonstrated just target areas to focus for all the MS patients. All of these studies had positive outcomes, so they had influenced us in creating our study for our Aunt Krista. Some class concepts that we learned were the autonomic disruption, so this allows us to make sure that we're having our Aunt Krista work out inside and not overheating. And we also made sure that we had exercises that helped her in her gait because you can see a decrease in gait, such as drop foot. So we wanted to make sure that we have exercises that will help her there. And then our Aunt Krista, obviously, yeah, she's an untrained athlete. So with her bowling twice a week and going on a 30-minute walk, this is not really a trained athlete, so we want to make sure that she has more exercises. So we're starting off at more of a baseline level, and then we're going to progress from there. And then, yeah, we're going to focus on her um, things that she wants to focus on, which is improving her balance, improving her grip strength, and managing her MS through her day-to-day life.
All right, now to assess some of the exercises that we chose, we had the suitcase carry, the pal-off press, and the lateral lunge as well as the split squat stance. So the reason we chose the suitcase carry was because it overloads one side, bringing her center of gravity outside of her baseline and adjusting what her base of support is going to look like with each step. Now, a progression that we have of this exercise is the overhead march. The overhead march is a progression because you have to balance the exercise, the load above your head, therefore bringing the center of gravity or the center of mass above where it normally is. Now we chose two sets by 10 yards each, or any 10 yards each. We said this because with our intensity wanting to be low and the time short, we don't want to have it be too long, and we have a long list of exercises that we want to be able to get through. So two sets at 10 yards is ideal for us. Now, the Pavlov press also trains trunk musculature as well as trying to correct her posture, making sure she's moving correctly. We chose the progression of the tall kneeling Pavlov press. Now, this is much harder than the regular standing up Pavlov press because you lose that lower musculature, that lower body support. So all the lower body musculature is no longer engaged. It's just the core. Now, similar to the overhead march and the suitcase carry, we chose two sets by 10 reps each side. Same thing, you're going to see a theme with all of these sets and rep range. We're keeping it around two sets with a low to medium rep range, trying to stay in that power and strength portion of hypertrophy. And same thing with her intensity, trying to keep it nice and low for her. Now, the lateral lunge we chose to improve her groin and quad musculature. Now, all of this musculature is super important in balance. And same thing with the lateral lunge, it trains in a different plane than a lot of the other exercises we chose. Now, the progression is the decline lateral lunge. We chose this because it allows for a way larger range of motion and it is a pretty high progression. So we likely wouldn't progress our ant onto this for a while. And now the split squat stance squat. We chose this because just same thing with the lateral lunge, just training in a different plane. She's keeping her base of support nice and wide, so it allows her to be able to load this exercise a little bit more than she has with the previous exercises. And our progression is the rear foot elevated split squat stance. We chose this simply because we don't really have a single leg exercise other than this one. The same thing here. It brings her base of support outside of her normal center of mass of 2 reps, 4 rep, or 2 sets, 4 reps each leg. Next, we chose our next four exercises, we chose the box step ups, the bench supported row, the incline push up, and the kettlebell swing with progressions as the box step overs, the gorilla row, kneeling push up, and the kettlebell snatch. So for the box step ups, we chose this because it's putting our client or our Aunt Christie on an unstable surface, getting that ankle and calf musculature engaged and changing her base of support. In the box step overs, it's a progression because you're stepping on and off of the box at a different plane. Bench supported row, strengthening that pull musculature, which is super important for her grip strength. Gorilla row, same thing, but just taking that bench out of the way. So she's going to have to keep her posture, roll her shoulders back. Incline push up, Want to be able to assess our aunt's upper body strength to help increase her grip strength, and then going on to a kneeling push-up is the progression, taking away that incline, making the range of motion a little bit higher. And then for our last and final movement, we chose kettlebell swing, getting a nice full body movement in here, trying to get a complex movement, training a bit of the trunk musculature, the quads, the shoulders, all that. And then we chose the kettlebell snatch as our progression, bringing it unilaterally, challenging her core and her base of support, bringing her center of gravity out of that again. Now we went on to mobility exercises and other physical activity. So mobility, just trying to assess that ankle, getting four-way banded ankle, box step overs like we did in the exercises just without a load. Shoulder roll is rolling those shoulders back, rolling them back forward, trying to increase that range of motion there. Arm circles and then thread the needle. Just trying to get her nice and loose, make sure that she's able to stay healthy. And then we added some fine motor skills as we saw in our one of our studies, such as knitting, sewing, and gardening, just trying to get her physically active outside of bowling and the exercises she's doing for us.
So yeah, and a lot of those exercises are based off of core musculature as well because she's untrained and we want to make sure that she has a good foundation when she starts her exercise program. So then once she progresses to those progressions later, she'll be well-rounded and not injure herself during the process. And during those exercises, we're gonna make sure that we can split them up based on her time frame, just 30 to 45 minutes. So we're gonna see how much she can get through in one day, and then we're gonna adjust from there pretty much. So, but just to conclude it all, the follow-up, we want to make sure that we need to inform her based on of all of her considerations and precautions. So we want to make sure that we inform her on her new medicine that she's been prescribed and all of those side effects that can be there, like headache and nausea, and make sure that she's taking rest if she does feel these effects. We want to make sure that we're keeping these exercises simple. We make sure that she's in when we're explaining these exercises to her, she's reiterating them back to us, making sure that she understands them when she goes home to do them herself. And then we want to make sure that she's working out inside so that overheating aspect can play a role if she goes outside. So then just to follow up, we want to make sure that she's progressing week to week. We want to schedule meetings with our Aunt Krista so we can know how she's progressing and if we need to make any changes to our exercise program. So this is the best way to do it, just to make sure we can have that interaction with her and adjusting as needed.
These are our references. Thank you.
Thank you.